Hey guys, welcome to my channel. Today we are going to talk about cirrhosis. Let's begin with two questions of mine. The first one: what vaccine can prevent cancer? What vaccine can prevent cancer? The second one: what bacteria can cause spontaneous bacterial peritonitis? So what bugs infect acidic fluid in adults and in kids? They are different, and I will reveal the answers at the end of the lecture. So let's go. Cirrhosis is a chronic liver disease characterized by fibrosis, disruption of liver architecture, and widespread nodules in the liver. The fibrous tissue replaces damaged or dead hepatocytes, and when advanced, it is irreversible. So, what are the causes of cirrhosis? First, alcoholic hepatitis. It accounts for 60–70% of all causes of cirrhosis. So, at the beginning, it is fatty liver, which is reversible, but then cirrhosis develops, and it is usually irreversible. The next one, viral hepatitis B or C. I'll remind you some histology. Hep B, ground glass appearance of hepatocytes. Hep C, fatty changes primarily. And viral hepatitis accounts for 10%. Non-alcoholic steatohepatitis, 10–15%. Metabolic syndrome, so obesity, results in fatty infiltration of hepatocytes. On histology, we can see cellular ballooning and eventual necrosis with fibrous tissue replacement of dead hepatocytes. Biliary disease, primary sclerosing cholangitis and primary biliary cholangitis. Let's talk first about primary sclerosing cholangitis. It is more common in men with ulcerative colitis. On histology, we can see onion skin and beading of bile ducts. P-NK positive. Primary biliary cholangitis. It is seen in women reproductive age. On histology, granulomas and lymphocytic infiltrate. Anti-mitochondrial antibodies present. So biliary disease accounts for 5–10% of all causes of cirrhosis. Next, metabolic disease, hereditary hemochromatosis. It is autosomal recessive disease caused by excessive iron absorption in the intestine. Iron in tissues forms free radicals and damages them. It is accumulated in liver, causing cirrhosis, in pancreas, causing diabetes mellitus, in heart, so cardiomyopathy develops, in joints with resulting arthritis. It darkens skin and causes atrophy of gonads and thyroid gland. Next, Wilson disease, autosomal recessive, caused by mutation in the ATP7B gene. So copper can't excrete into bile and incorporate into ceruloplasmin. We can see in blood tests low ceruloplasmin and high free copper. It is accumulated in liver, in cornea, where we can see Kaiser-Fleischer rings, in CNS, particularly in basal ganglia, so it causes extrapyramidal symptoms and psychiatric disturbances, and in kidneys, where it causes nephrocalcinosis and aminoaciduria. The treatment of Wilson disease is dipenicillamine and zinc. Next, alpha-1 antitrypsin deficiency. Codominant trait, misfolded gene product protein aggregates in hepatocellular ER, resulting in cirrhosis with PAS-positive globules in liver. It often presents in young people who have also dyspnea. Metabolic diseases account for 5% of causes of cirrhosis. Autoimmune hepatitis is strongly associated with anti-smooth muscle autoantibodies. Vascular diseases Congestive hepatopathy is caused by right heart failure or constrictive pericarditis. Budd-Chiari syndrome is caused by thrombosis or compression of hepatic veins. Hepatic veno-occlusive disease can occur after bone marrow transplant. Cystic fibrosis. Also, medications such as methotrexate and acetaminophen toxicity. And parasitic disease, mainly from schistosomiasis. Symptoms usually are vague and many people don't have overt clinical findings until they develop complications. So, moving on to complications of cirrhosis, and the first one is portal hypertension. And let's recall portosystemic anastomosis. The first one is located in the esophagus. So, the left gastric vein dumps blood to the esophageal veins and then to azygous vein. Thus, esophageal varices are formed. The next one is located near the umbilicus. So, parumbilical vein commences around the umbilicus and then runs into round ligament between the layers of falciform ligament and ends in left portal vein. Parumbilical vein directs blood to the small epigastric veins on the anterior abdominal wall, so caput medusae can be developed. The third one is in the rectum. Superior rectal vein drains blood to the middle and inferior rectal veins and then to IVC, thus forming hemorrhoids. Moving on to ascites. It is accumulation of fluid in the peritoneal cavity. It is caused by decreased oncotic pressure from reduced synthetic function of liver and increased hydrostatic pressure from portal hypertension. The ascitic fluid can become spontaneously infected, and in this case we will see white blood cells more than 500, polymorphonuclears more than 240, and positive cultures. We can perform paracentesis for a diagnostic workup and find out what is our serum acetic albumin gradient. If it's greater or equal 1.1 gram per deciliter, then we can conclude that portal hypertension is likely. The absolute contraindication for paracentesis is acute abdomen, which requires surgery. The next complication, hepatic encephalopathy. It develops when ammonia accumulates and reaches the brain. Clinical findings: decreased mental function, confusion, stupor, and in severe cases, coma. What also can we see? Hysterexis, flapping tremor, hyperreflexia, and rigidity. Next, hepatorenal syndrome. Vasoconstriction of renal vessels ensures renal failure. Coagulopathy. Reduced synthetic function of the liver causes a decrease in clotting factor synthesis and thus decreased PT. We can reverse it only with fresh frozen plasma. Next, hepatocellular carcinoma. 10–25% of patients develop HCC as a result of cirrhosis. So we should monitor AFP and perform liver ultrasound every 6 months in patients with cirrhosis. And the last complication that I'm going to talk about is hyperestrenism. It develops because liver can't break down estrogen. So we can see in a patient spider angiomas, palmar erythema, gynecomastia, and testicular atrophy. Okay, diagnostic tests. How can we do it? We can perform liver ultrasound, CT or MRI. And now I'm going to show you CT scans of the cirrhotic liver. Here we can see uneven edge of the liver, surface nodularity. This is gallbladder, and this is the right branch of portal vein. Oh, it is so dilated. So this patient has portal hypertension. Look at his spleen, it is huge. Okay, it is pancreas and aorta. Okay, this CT scan is made without a contrast. Let's jump to the treatment options in cirrhosis. We can place transjugular intrahepatic portosystemic shunt to lower portal pressure. If a patient has variceal bleeding, what can we do? We can administer non-selective beta blocker. If a patient has massive bleeding, we have to, first of all, maintain his blood pressure, give him IV antibiotics. Octreotide, it causes splanchnic vasoconstriction, thus reduces portal pressure. And once this patient is stabilized, we can do upper GI endoscopy and perform ligation or sclerotherapy of these varices, or perform balloon tamponade. In case of ascites, we recommend salt restriction and diuretics. Diuretics are spironolactone plus furosemide. In case of spontaneous bacterial peritonitis, we give a patient broad-spectrum antibiotics, then specific. How do we treat hepatic encephalopathy? With lactulose, it is metabolized in the intestine to acidic compounds, which helps convert NH3 to NH4+ that can be excreted by kidneys. Also rifaximin to kill gut flora, and we recommend limit protein to 30-40 grams per day. And the definite treatment is liver transplant. But to be eligible, a patient has to be abstinent from alcohol for more than 6 months. Let's talk about Child-Pugh Classification to assess severity of liver disease. It is composed from several categories: the severity of ascites, total bilirubin, the presence of encephalopathy, grades 1 or 2, suppressed with medications, 2 points, grades 3-4, refractory, 3 points, levels of INR and serum albumin. The point scores are then added up and classified as class A, B, or C. Okay guys, and now I'm gonna give you the answers. The first question was, what vaccine can prevent cancer? The correct answer is Hep B. It prevents development of viral hepatitis B, thus cirrhosis, thus HCC. So the right answer is Hep B. The next question. What bacteria are the most common causes of spontaneous peritonitis in adults and children? The correct answer is E. coli in adults and Streptococcus pneumoniae in children. So, congratulations for those who were right. Don't forget to subscribe to my channel, push the like button, and see you in the next video. Happy studying! Bye! The correct answer is